Hello, Gold participants from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And today I'm chatting with Dr. Andrew Kotaska about his upcoming presentation titled Heads Up, Not Hands Up, The Unexpected Breech Birth. And this presentation is part of the Gold Midwifery Online Conference as an add-on and will be available starting February 2017. I'm so excited about this topic. I can't wait for the presentation. I'm so glad you had time today to speak with us. Welcome, Andrew.
Hello.
Andrew, tell us a little bit about yourself and your professional journey and how this topic became an area of interest to you.
So I'm originally was a family physician who had a keen interest in obstetrics and began working in rural areas that didn't have specialist obstetricians to do cesarean sections. So I went back to train to do cesarean sections with a very experienced obstetrician in the Lower Mainland in British Columbia, and he happened to be very skilled in breech birth and taught me his method of breech birth. And being a modern um, practitioner, I wanted to have some idea of what the level of risk associated with vaginal breech birth was. So I audited the results of that hospital for the previous 10 years, and out of several hundred cases found one bad outcome due to an unrecognized cord prolapse. And shortly thereafter, the term breech trial was published and suggested that actually we were harming or killing 1 in 20 babies that were allowed to labor breech. And this was totally inconsistent with my experience in training and my audit of the results of the hospital where I was training. And so that led to an interest into what the real risk was around breech birth and why we had misinterpreted it.
It's definitely very interesting. And you mentioned something right there, the risk. And I can see that there is also a lot of fear involved with dealing with breech birth. Many modern practitioners and midwives or obstetricians, they don't get to do many breech births anymore. There's a lot of cesareans around, so this will be a fascinating presentation to watch. So tell us a little bit, what barriers have you encountered when shining light on this particular topic?
Uh, I think you've alluded to the main one, and that is actually getting adequate hands-on experience um, to become uh, comfortable with breech birth. And that's not a complete oxymoron, even though it might seem like it. Um, but in the old days, breech birth was sort of this magic box, and it was the art of breech birth, and you either knew how to do it or you didn't. And no one could really describe what was in the magic box. It was kind of like a magic trick. Um, and I guess that was one of the problems with the methodology of the term breech trial was they just said that somebody had to be there who considered themselves experienced in breech birth. But they never really dissected out what it was, what that meant, both from the standpoint of making a careful, safe selection of who's a good candidate for a breech birth, or what the intrapartum safety factors were or techniques were that one needs to know to maintain safety in a breech birth. And so I think that's probably been one of the main goals in my teaching about breech birth is to demystify it, to actually um, take apart the individual factors that are important to safe selection and intrapartum management of a breech, and therefore also hopefully decrease the amount of time and the amount of volume of experience required before a clinician actually feels somewhat comfortable in managing a safe breech birth.
I like how you mentioned that magic box for breech deliveries. You're right, there was not much data available before what is safe and what really qualifies for somebody who has good experience in breech birth. So that brings me to our next point. What do you hope our delegates will take away from your presentation?
Well, as you can imagine, being asked to cover breech birth in an hour is sort of like asking somebody to do a PhD on a weekend. So I think in an hour, what I really hope to do is as much as possible, well, cover a little bit of the background and how we got into this situation of fear, and to try and dispel that fear by um, sort of dissecting breech birth and the key components necessary to safety, and to try and boil it down to, a number of things that you can count on one hand or at most two hands, so that if you are presented with an unexpected breech birth, you can keep the panic at bay and think about those five things that will, both uh, keep keep your continence and also maximize safety for mother and baby.
Well, thank you so much, Andrew, for chatting with me today. We are looking forward to your presentation. And this presentation, as I mentioned before, is part of the Gold Midwifery Online Conference as an add-on. And you can check out for more information on this presentation and other presentations, please go to www.goldmidwifery.com. Thank you all for listening today. Bye for now.